Good evening, everybody, and welcome to CURE and to this very special evening of discussion about very important topics that we're bringing to you in collaboration with Aspen Science and Society program, the future of healthcare and science. And we're going to talk today about what we all has been on our minds. I mean, the upcoming elections are only 3 weeks away. And we know that regardless of what happens at the elections, a lot of things are on the ballot box, so to speak. Very important issues on science and healthcare. And today we're going to talk about discussion about that and answer your questions as well. And so joining me are a few esteemed panelists, and we are doing this in collaboration with Aspen. And so I wanted to recognize Aaron Mertz, who is the head of the Aspen Science and Society program that is focused on exactly issues like this and creating trust in science and trust in healthcare. And so Aaron, first of all, thank you for this collaboration. You want to say a few words of welcome as well?
Sure. Thank you for the introduction. And I also want to mention that we're very proud that Seema is the co-chair of our program advisory council. So she gets to lead us through some really wonderful meetings as we had earlier today with a very esteemed group. Why we're here today, we embarked on a similar project 4 years ago about the future of science in America leading up to that election. And we addressed very important issues like trust in science and science philanthropy. And a lot of the issues are still around, things like climate change and the environment. But there are new topics that have emerged that we were able to explore in the magazine that became the impetus for this event today. For example, artificial intelligence, which was around 4 years ago, but with the release of ChatGPT became a very big thing across sectors within the past year. And also, the concept of civic science has been growing over the past number of years. We've worked a lot on that burgeoning field, which is about how science can be used as a better tool for civics within our culture. And we have a great article in our magazine about state-level projects that can enhance civic science and society more broadly. So the impetus for this event was a magazine that we are producing with the science outlet Nautilus. And my colleague Carrie has been helping lead our efforts on that magazine. I first came to know Carrie just a few months after I started the Science and Society program, back when she was in charge of science and society research at Pew. And recently she joined our team as a senior advisor, so we're really grateful to have her input into our work. So thank you, Seema, for hosting this public event today. The magazine articles are still coming out. We've released about half of them, a little more than half so far, and they're available on the Nautilus website and will soon be available on the Aspen website, and that's exploring, as we said, science at the ballot box.
So, Aaron, I've been confused all day long between Carrie and Corey.
We answered to both.
Yeah, we answered to both. So Carrie, Corey, Powell.
Carrie, I'm Corey.
You're Corey,
I'm Corey.
Yes. So Corey Powell,
Yes.
you are, an esteemed journalist. You are somebody
Some
who
say.
has been, deeply rooted in science and policy and covering it for a long time. Say a few words about yourself and, your particular role in this particular arena, but also, what you have done so far in your life.
Sure. So I started was a fairly traditional aspect of old school science reporting and editing. I was an editor at Scientific American. I was an editor at Discover magazine. I worked in a bunch of different roles there, ending up as the editor-in-chief of Discover. And so I came of age at a time when science and health reporting was a very potted, predictable kind of thing. There were 3 broadcast networks there, plus PBS. There was there were a handful of newspapers that had science and health sections. There were three big science magazines, plus maybe 4 if you count National Geographic as a science magazine, that would talk about health issues, and that's where people basically got their information. And so it's been very interesting to me, and I've seen a lot of problems and also a lot of opportunities over the past 20 or 30 years as the old media system has exploded. There are many more opportunities for misinformation, but there's also much greater public access. I mean, people can read research papers directly, people who never would have had that opportunity before. So, so my career has all been about adapting, adapting new types of misinformation, adapting new ways to communicate to the public, and try to keep that balance on the right side between the growth of misinformation and the growth of access and opportunity.
As with all cycles, right, whether it's science, journalism, science policy, science and trust in science and the public, all of these trends go through ups and downs. So, just like the market, just like anything else, there's a boom and a bust. And during the pandemic, it seemed like for the first year, it was the best of times. There was a boom, it seemed like. Everybody was listening to scientists. Scientists were the heroes. They were going to save us from the pandemic. They were working on vaccines. And so, so there was this, sort of a very, despite the whole, gloom and doom of the pandemic, the silver lining was these heroes, scientific heroes who were doing this stuff. Year two, it was the worst of times for science and science policy and disinformation, misinformation, but also trust in science. So I would love to hear all your thoughts on, your key takeaways from those times and lessons we could learn for applying in the post-pandemic era. So do you want to start off since you have the floor already?
Sure. Look, I think the basic challenge here is that you're always dealing with human nature. The technologies change, but human nature does not change. And one of the really
despite artificial intelligence.
well, we'll see. It's possible if the singularity happens and we merge with computers, maybe human nature will change then. But I'm withholding judgment. But so like during that kind of flip in the pandemic, I did what I think a lot of other journalists did this too. They went back and looked at what happened during earlier epidemics and pandemics, especially like what happened in 1918 around the enormous flu epidemic then. If you go back and look at the story from a century earlier, there were anti-masking demonstrations and there were conspiracy theories and there was at the time yellow journalism that was the sort of like the print equivalent of
tabloid,
of all the crazy stuff going on social media. There are some basic impulses that when people are scared, when there's a breakdown in trust, there are bad actors. There's paranoia. There are all kinds of sort of natural, unfortunate human tendencies that just erupt when you lift the lid off. So I feel like some of this is. Some of things that I think we're going to talk about tonight are kind of evergreen topics. This is the never-ending battle against like the best and the worst aspects of human nature. I mean, the challenge is, with Twitter and Facebook and all these other things that people have now, it's possible to spread things much faster and much more widely than it was before. And so these human nature can now be broadcast in a way that it couldn't before. And I think that's the big challenge.
That's interesting. Yeah, if you don't mind, I'll just add to that. I'm a social scientist. I was doing public opinion polling at the start of the pandemic. I see it, I guess, in a slightly different lens, which two things. One is to remember that, we did develop vaccines in rapid fire time. So there was a success for the scientific community. But I think a lot of people were thinking it would be a huge success for public images of science, and that's where it didn't quite go as planned. What happened in those early first weeks was a kind of, there was a lot of consensus, there was a lot of agreement around the need to have restrictions on public activity, but within about 6 weeks, we started to see a division of opinion around those kinds of measures, and that division was largely along political lines between the two major parties, or ideological lines, if you wish. And what happened since that time was that persisted and really has widened over time. So we had a situation where there had sometimes, where there had sometimes been really minimal disagreements along partisan lines, but instead, during the pandemic, we just had a political debate over every aspect of how we respond to the pandemic. And so that's kind of where we are now and what is a bit concerning for many in the scientific community because they're not really used to dealing with that kind of division around their work.
That's right. So what about you, Aaron? I mean, where do you think we are now, from the lessons learned? And what is the value of science to society today, you think, and public's image of, and the role of science in society?
As Carrie said, shortly after this initial great wave of pro-science, I think we're almost back to where we were. I'm really grateful for the pandemic to have shown me how little people understand that science is an evolving process. And the example that I give in this case involves public opinion. You might know the numbers on this, but early on in the pandemic, as you may recall, the guideline was to wear a mask if you are symptomatic. Then the guidelines changed to wear a mask at all times. Instead of that change being heralded as a breakthrough because of science and new data that emerged and a new policy we now have, it was seen as science flip-flopping and science being wrong and not knowing what it's doing, and it hurt science's image when science flip-flopped like that, but actually it was science doing what science does best, which is responding to the data at hand when the new data showed that people could transmit COVID asymptomatically. So everyone should wear a mask. So I think that lesson was really important to my colleagues and me to realize that people don't understand science as a process and that they should.
That's an interesting thing because this afternoon, as Aaron said, I'm the co-chair of the Science and Society Committee for the Aspen, and we were talking about this exact same issue, which is that science is a process, and there is often new data that comes in that makes you stand up and think and reevaluate things. And so you're making a decision, you're making a suggestion, a recommendation based on the data at hand at that moment in time. And if you don't follow that scientific method, it feels like you're flip-flopping. And that's same from a journalistic standpoint, right? You're covering the news. One day coffee is good for you. The other day, we all had a glass of red wine or rosé or whatever your drink of choice is, and we're thinking, it's good for my health, right? Resveratrol, it's making me feel good and whatever. But tomorrow, I could get cancer from it. And so when you report things like that as a journalist, how do you feel about the responsibility of a journalist in making sure that, you're not giving the public conflicting information on a day-to-day basis?
So it's funny you mentioned the example of coffee. So one of the things that I did during the pandemic is I collaborated with a few friends and started a magazine called Open Mind. It's a small magazine. It's kind of like a little journalism laboratory that we created for testing out different models of science journalism, especially how to break the sort of like it's good for you, it's bad for you style of journalism, yes, no, and our funder. Great guy, heart in the right place. He was very concerned about science misinformation happening during the pandemic. He was very generous with us in starting this magazine. And then we talked to him about what we were doing, and he would say, yes, but what I really need you to do is answer the question like, is coffee good for you or bad for you? And I was like, the guy who's giving us our funding, the guy who's like supporting our mission is asking exactly the wrong question, because as soon as you're asking, these sort of binary answers like, good, bad, yes, no, you're forcing things into categories that is not how the real world operates. And in our daily life, we know that the world doesn't operate that way. You don't think, I'm going to cross the street against the light. Is that dangerous or is that safe? It's like, it's a little bit dangerous. And you judge how dangerous based on how much traffic there is and, and how much of a hurry you're in and how much risk you're willing to take.
And sometimes it's green and the walk signal is
Right,
not on,
right.
but there's no cars coming and you cross the
This is the
road.
thing. Intuitively, we all understand that binary
But in
answers
Seattle, no.
are not the real answers. But at the same time, there is this is like our good nature and our bad nature. There's a part of us that just wants an answer, and especially in journalism, a headline that says yes, no, that says something sensationalistic, people are more likely to read that. And so the challenge to journalists is how to make
But you've got to sell newspapers at the end of the day.
The challenge is how to make a maybe story interesting. And that was part of what we were working on at Open Mind, is how do you tell stories that are about why don't we know the answer? Why is it so hard to find the answer? How do you judge risk? How do you just go ahead and live your life with uncertainty? How do you turn those things into stories that are compelling enough that people will read them? And it's a challenge.
That's a challenge.
But I feel like that's what journalists should be working toward.
I think we have that problem stemming from a very young age in the way that science is taught in schools. It's taught as a finished endeavor with the great figures of the past whom we're worshiping. We are looking at textbooks with closed covers, examinations with a solutions set. Science is actually an evolving process, and this is one of the things that we take on with young people in my work at the Aspen Institute. We have a youth initiative called Our Future is Science, where we connect in a mentorship relationship high schoolers with STEM graduate students to explore how science and the scientific method can be living, breathing concepts that apply to contemporary issues in their own communities and can help solve those issues that they observe firsthand. So science is a dynamic, living, breathing entity instead of this solution set for a homework assignment.
Yeah, because I think, at the end of the day, how do you communicate a process, right? It's not interesting, quote unquote, right? But because that's what we're taught from the young age, that this is not interesting, you have to have an answer at the end. So from a science to society translation standpoint, how do you tell that story of ambiguity, not quite there, relativity?
Yeah, these are the hardest questions, but the thing I would point out is that what the public needs is multifaceted. So there are people out there that want all of the details, and there are people out there that just want the summary. Is it good or bad? And that they're both okay approaches, is that we need to be putting out information that allows people to kind of be where they are. I think to Corey's initial point, which is that we don't just have traditional media anymore. We have all sorts of people who are trying to dissect and do a public service, but they're doing it independent of kind of traditional organizations, and they can add, I guess, they can add misinformation, but they can also kind of bring threads together that are helpful. So I would just say that some of those people are trying to help dig below the surface to show more about the methods, because often there are questions about the methods and how good is the quality of the research. And to that point, I think we need to make sure that we're not essentially oversimplifying for the public, because there are plenty of people who can and want to make sense of those details.
Carrie, that is a really good point. And by the way, Carrie, before you joined the Aspen Institute Science and Society, you were at the Pew Research Institute. So you know a thing or two about research and understanding, public opinion and other people's opinions. And one of the things that when I was at Johnson & Johnson, we were working on the COVID-19 vaccine when this was all taking place. And what was interesting to me was, before, journalists who didn't care, just give me the headline, just give me the press release, but not only them, regular people were calling and asking for our scientific protocols to be published online. They were asking about, probability scores. They were asking about the N numbers. How many people did you do clinical trials on? All of the statistical analyses behind it. All of a sudden, people who probably would never think of themselves as mathematicians or statisticians became that, because they were trying to make decisions on probability of this vaccine versus that vaccine and what percentage versus this percentage. So to your point, we should not immediately assume, people are intelligent, they're smart, they can make the they can tell the difference between plain red and green light versus something in between. So I think that trying to figure this out, the secret sauce of trying to give people information quickly in easily digestible ways, but still not forgetting the nuance, I think, is really the key. Would you agree?
Absolutely. I think one thing that comes to mind from that story is just how much we've changed. So I think the lasting change there is an expectation for full transparency. Give us the protocols and let us make sense of it. And maybe that can be misguided. Not everyone wants to dig in, but I think partly because as a whole, society is less trusting of all sorts of groups and institutions, that the science community needs to plan on and expect a more skeptical public, one that wants to see for themselves. Maybe they won't dig into every detail, but they appreciate that it's available, and that in itself helps build the confidence that they're following good protocols.
That's really great, because I think, pandemic is now old news, right? The new kid on the block is AI, right? And everybody's talking about AI. One day AI is good, coffee is good for you. The other day AI is going to take over the world. We're all going to be ruled by humanoids, right? And so, how do you again tell that nuanced story about AI? And so your thoughts, first of all, and we'll just go down and ask everybody their thoughts on how do you best communicate the promise, but also the guardrails we need to ensure we have in place on AI.
All right, I'm going to cheat a little bit
Yeah.
with my answer. I'm going to start with sort of a general principle, not specific to AI, but it's something that I try to do in my communication, but it's also something I encourage everybody to do. If you're a doctor dealing with patients, if you're a scientist dealing with the media, if you're a news reader just dealing with news stories, I'm a big believer in sort of teaching people how to ask the right questions. There was this. It's a total cliche now. The people who do their own research and what they're actually doing is they have something they believe and they're just going to sort around until they find something that supports that belief. But if you
Confirmation bias.
Exactly, it's confirmation bias. But if you really teach people to ask sort of two key questions, you can go very far. And for AI or anything, people say somebody says it's good or bad, ask compared to what. And if you have an opinion, you just ask people, could you be wrong? And those two questions, like compared to what and could you be wrong, I feel like is so helpful in sort of forcing, rather than pushing information at them, draw them out and force them to sort of confront themselves. So, with AI, again, another cliche, AI is a tool. AI is a very complicated tool. It's being deployed in a lot of ways that I feel like a lot of us don't really understand, which makes it, mysterious and frightening. But, to be able to generate images really quickly, to be able to, come up with 10 ideas for a headline for a story I'm writing, or for, I have a daughter in college and a daughter in high school, and they just sort of look at it as a curiosity. It's like it's sort of a thing they play with sometimes to make a picture, sometimes to get an idea for how to start a story, and that's it. It's just kind of in their landscape. And I think at least for now, given its wide applications, but it's sort of untested power. I think that's a reasonable way. It's a tool that we're all exploring.
Keep an open mind, you say?
I try to. It's part of my branding.
We can't have a panel like this and not talk about AI. One thing I think we already brought up is just keep in mind this is still a very new development. We started talking about trying to measure public opinion around emerging science and tech developments, including AI, several years ago. And even after ChatGPT kind of brought more public notice to AI, we know the initials, we know the two words, but how much do we really know beyond that? And I would say there's still limited understanding of exactly how it works and what some of the downsides are. And I think overall, in terms of the public opinion work we've done, people are willing to both believe the worst and the best. So people see that potential for the idea that it could be more systematic and take some of our human biases out of the equation. But what they don't always see, because they aren't technical experts, is that there are still human biases in the equation, in fact, in the machine learning algorithm, right? And so some of our most famous examples where AI has gone wrong are, are things that only the experts can see, which is why the people who are clamoring for ethical AI, responsible AI, are talking about the need for kind of a systematic awareness and looking for potential problems that we didn't expect, so unintended consequences. I'm going to give two examples, I think, and one in healthcare and one borrowed from an article that our colleague just wrote, Jelana Sheets, just fresh off the press, around the uses of AI in government. And so one well-known example in healthcare was using AI to help diagnose skin cancers. Didn't take that long for experts to raise the question like, hey, all the training data is based on people who are fair-skinned, coming from North America, Australia, New Zealand, Europe. And so it wasn't too much longer before people realized, oh, there's a problem there. Similar example from some HR applications at Amazon, I believe, where they were using AI systems to help predict essentially who was going to be a more successful employee. And I believe after about 10 years, they pulled the plug, or at least they identified that there were some systematic biases because they were using training data essentially from early employees who were systematically more male and probably also more white than the goal of the workforce. So those are the kinds of things that make you worried because only the experts can kind of uncover them. And, the public will follow along as they see more of these cases.
Those are great answers, and I actually want to turn this back to you, Seema. In your work in healthcare, how do you see AI converging on or impinging on healthcare work?
On the one hand, I think it has huge amount of potential, and it's not new. It's already making a big difference in healthcare. So in the basic research arena, in discovery, I think AI is being used on a routine basis to take away some of the scut work, essentially. Because somebody who is doing things, a scientist who is doing the job of actually generating the data, could instead be using the intellectual prowess to be interpreting the data rather than actually doing it. Similarly, healthcare workers, going back to the pandemic, we saw how overburdened they are. Physicians are overburdened because their time is spent, taking notes and keeping notes and all of that. And instead of talking to the patient and making eye contact with them, they're busy typing notes of, all the things they're doing, and they're seeing lots of patients. Instead, AI could be taking that sort of administrative burden. So already AI is having a huge impact. Down the road, I think we're going to see even more impact of AI. AI is going to be able to generate a lot more predictive power, which I think is going to be important. At the end of the day, the human will still be in the loop because at the end of the day, healthcare is about human lives. And when people's lives are at stake, the final decision maker will be human for the foreseeable future. But that's not to say that you cannot take some of these administrative tasks and give it to AI or augmented intelligence. AI too requires probably some rebranding because artificial intelligence makes it seem as though it's something. It's really, but to the point that you were making, it's garbage in, garbage out. So if you have incomplete data, if you have biased data, because what AI is nothing more than a artificial brain that we train with the data to learn something new. So the teacher, is just as important as the student, and the student is the AI system. So I think that's what we're seeing. But here at CURE, we are developing we launched an innovation challenge last year, AI for Good, and we saw so many applications. We had a hard time making the final selections of the winners because it's incredible applications for AI for good. But on the other hand, there is also some governance needed. While governance is needed, AI is here to stay, just like cars. We're going to need like traffic regulations and things like that for cars. And similarly with electricity and with computers and with everything, we will need to kind of make sure that society keeps pace with science and is thinking about this ahead of time, just like with the Human Genome Project, it was the same thing, right? So the ethical, legal, social implications will need to be, lockstep, but you shouldn't be limiting the science and its potential to really impact healthcare and save human lives and bring forward cures. And so that's really the promise of AI.
Yeah. Including and beyond AI, I want to ask, we would be remiss not to talk about policy at this event that's centered around our magazine, Science at the Ballot Box. And I should say that I'm coming from the perspective and the vantage point of a 501c3 nonprofit organization that maintains a very nonpartisan angle, if you will, in its work. And so we don't take a stance on specific candidates or policies that are up for election. But can you talk, Seema, about AI and beyond? What policies could our government be doing differently that could ensure better scientific and health care for our population?
Obviously one of the biggest things that everybody is always rooting for is more funding for basic research, right? So, you could never have enough funding for basic research, because at the end of the day, the non-dilutive funding that comes from NIH is the important work that gets done in many of the laboratories in the United States, in all the universities in the United States. That's where new breakthroughs come from. Then more funding goes in from biotech, from industry, from investment community to actually take it to market and make it into the medicines that we take, right? So this entire ecosystem, this industry, is an important industry that we need to ensure that trust in this industry, investment in this industry continues to take shape. And one of the biggest landmark legislations to pass recently has been the Inflation Reduction Act. And that has to do with ensuring access and affordability for medications, right? I'm just simplifying it for the moment. There's multiple different iterations and layers to it. But the access and affordability, who can argue against access and affordability? We want this to be, something that is available to all, because healthcare, after all, is a human right. But at the same time, how do we make that possible while continuing to allow industry and academia and that whole ecosystem to continue to generate IP and revenue in order to make the industry sustainable? And so that's something that we have to constantly be talking about and be watching for. And AI, to some degree, could help us in the future, because it could cut costs in the system. Telehealth, which we all experienced during COVID, because you could get medical attention. You figured out how to do your own COVID testing, right, and send it off to the laboratory. Now, what have we reverted back to? In more, going to the doctor's visits, all those add up in terms of cost. So AI and telehealth and things like that could help. So how could we ensure that that is taking place? So that's another important thing. The one more thing I'll mention that's on the ballot box, and I think that's up for discussion, two things actually. One is what's called the BioSecure Act. The BioSecure Act is to ensure that we are securing our own ability to make raw ingredients and API, as they call it, pharmaceutical ingredients, here in the United States, rather than shipping it off to China, which is what we do. And not that it's not about just national security. It's much more about our capacity to do it here, reduce timelines, reduce costs even, to do it here and bring things to market sooner. And the last thing, of course, that's been debated is the Affordable Care Act, and that it doesn't seem like there's much going to change regardless of what happens. Again, a bipartisan view, and I think the BioSecure Act and the IRA both have been things that are, at least what it seems like is a bipartisan view on things. And so healthcare is something that we really need to care about.
Corey, could I ask you, in this rapid information age more than ever, how can people discern good and bad information from one another. And could you tell us about Open Mind, one of the projects that you've worked on?
Sure. So Open Mind is the magazine that I created during the pandemic, primarily with my colleague Pamela Weintraub, who I worked together with at Discover Magazine, and we really created Open Mind to experiment with answers to that question. So the magazine itself is a fairly small startup. We got some funding from the Pulitzer Center to sort of help build what we're doing. But then we struck a number of partnerships with major publishers like Scientific American to get our pieces out to a wider audience to kind of see what worked and what didn't. I think some of those tools that I was talking about earlier were experiments that we ran of trying that every story that we did, no matter how abstract the topic, had a section on basically things that you, the reader, can do. Certainly pragmatic takeaways. If you want to understand this better, or if you want to apply this in your life, how can you do that? Some of the time explicitly, most of the time implicitly in the stories, we sort of built in those kinds of questions I was talking about earlier how do you know if this researcher is right? Could this researcher be wrong? If you're saying this is a good solution or a bad solution, always frame it in terms of compared to what. So so for instance, we did a piece on adaptation to climate change, and the story didn't deal with the evidence for climate change because climate change is happening. We don't you don't really need to go review the evidence. You don't need to review objective evidence. But what you do about it is a big and open question. And the story was really about how do you know if we're making the right kinds of adaptations? You have to do something, but how do you know if you're doing the right thing when, in many cases, the institutions and the funds that are on the table are kind of like designed for old problems, or there are people who already have vested interest in doing things a certain way that might not actually really be helping the public the most. So. That's just sort of one of many examples. We try to treat every story as a little bit of a laboratory for, can you actually do interesting storytelling? And I think that the challenge with all these, with communicating about all these problems is that people like a story. A narrative story is the natural way that people think. It's how they hear. It's how they process things. A story that ends with, well, we don't really know, but life goes on. Nobody likes that story. That's not going to get a sequel. It's not going to sell tickets. So that's always the challenge is how to make the process of investigating a mystery, how to make that an interesting story. And I think with AI, look, we're right in the middle of it, where you can see there are in healthcare and all these different fields of science that produce these giant data sets that are so big that no one person can look through it. Having an AI that can look for patterns for you and can find evidence of a disease emerging here that you couldn't see in just the kind of like the raw data coming across your desk, that's cool. That's amazing. That actually tells people something concrete about, okay, here's what AI is actually good for. It's not, the most interesting thing about AI is not that you can, type in something and you get a picture of a goat riding a bicycle, although that is pretty cool. Yes. But the fact that the same techniques that do that can also do all this really sophisticated pattern recognition. That's kind of interesting. I feel like that's the challenge for all of us, both in understanding and communicating, of like how do you tell those stories?
Carrie, one of the most interesting tragic stories from the past years was the vast wave of anti-vaxxing that occurred as a result of the pandemic. Without that specific issue of COVID-19 vaccines, what trends have we seen affecting other vaccines for other diseases or for standard childhood illnesses? What have we seen?
Yeah, I think we're still eyeing what's going on. I think the initial read is that, yes, there was kind of an increase in the number of people who expressed hesitancy around vaccines generally. And obviously there was, a segment of the public that was very concerned about the newness. What they would say again and again is that it's too new. It hasn't been proven for the coronavirus vaccines, and they often would use the contrast compared to the measles, mumps, rubella vaccine or something like that, where we had decades behind us. So it felt very new and unproven, and I think that word is important because it's a word we haven't brought up yet. Emotion is actually critical in this whole thing. Yes. The reason storytelling works is because actually it evokes emotions in us, and that's kind of what you remember. And what was happening with vaccines is that for some people, it did evoke, fear, I think. Because I'm a public opinion researcher, I am always listening for the other guy. And what we did at that time was do a series of qualitative interviews with people who expressed more hesitancy around vaccines, either COVID vaccines or MMR vaccines. And their stories were powerful. One of the things that I know from this work is that there is no single person who is the embodiment of a person who's hesitant around vaccines. And the stories they told were those powerful stories of healthcare where often there was some reason why their child or their spouse had some complex interaction in the past that made them particularly nervous about getting a vaccine. And so those were the people who would really dig in to read the medical research themselves, and that they were looking for answers. They were often not single-mindedly against vaccines, but they had reason to be scared, and so they made these judgments. So I want to just humanize them a little bit in that conversation. The question is, I heard a lot of people separating a distinction between, let's say, childhood vaccines and COVID vaccines. There are many more people who were hesitant around coronavirus vaccines than they are around MMR. But nonetheless, in the U.S., we are seeing a slight uptick in what you would call non-compliance. The rates of MMR vaccination for the especially the 6-year-olds is going down just a little, but a little can be very impactful since as it's going to affect our ability to be immune.
Absolutely. I think that with respect to vaccine hesitancy, it's such a complex thing. There is no one particular. You try to dissect folks and try to say, okay, just like with a political campaign, you say, okay, I'm going to get to Pennsylvania and see if I can convert these voters. It doesn't work that way because there is a lot of different dimensionality to why people may or may not trust vaccines or anything else. But I think in the particular instance of COVID-19, I think there was the role of disinformation and misinformation, which wasn't there in the past with other things. And so I think that part of the equation, whether it's vaccines, whether it's something else, or whether it's just media, whether it's conspiracy theories, it doesn't matter. But this new world of weaponizing information is something that we do have to watch out for, because you're basically swimming against the stream when you're trying to communicate information, especially information that is ambiguous, against disinformation that can be very precise, right? And so this is where I think we need to ensure that we're bringing people back to, the basics and the education, and that's why efforts like Science and Society and some of the things that all of us in our professions are doing is important to ensure that trust in the scientific enterprise and scientific method continues, and that healthcare as an industry is something that people continue to trust, because what we're also worried about is physicians leaving the industry because they're tired of people coming to them with misinformation and disinformation.
So that's interesting. If I can ask you, I mean, is your sense that people maybe were distrustful of medicine, but we're still trustful of their own doctors? Because that's my impression is that there's always a difference between there's a very common difference between people's sort of diffuse attitudes toward an invisible other and their attitudes toward the people they actually know in their lives.
It used to be that way, but I think there is this new concerning trend I think that we need to be, cognizant of, which is people are coming to their doctors already self-diagnosing. And then when the doctor says, well, actually, no, I don't think you have XYZ disease, it's actually nothing to worry about, then they're questioning and they're saying, no, well, I Googled it. And
Yes.
and I found out that,
the doctors call it Dr. Google.
Yeah,
Dr.
Dr. Google.
I talked to Dr. Google.
I talked to Dr. Google. But Google is one thing, but sometimes they get disinformation. And so I think that this is where, how do you help the public? And I think efforts like, whether it's a revival of good science journalism or dialogues like this or science and society efforts, I think are important in setting the framework. People should decide for themselves. Nobody, should be telling them what to do, but how to evaluate what's right and what's wrong for you, which may be not the same as what's right and what's wrong for that person, I think is an important critical thinking capacity that we could particularly foster.
In our last 15 minutes, I understand Seema needs to go to an event, so we've been team tagging on the moderation. I'd love to open this up to the audience for questions, especially for Carrie and Corey, who are here. Is there anyone here who would like to? Good, I see one hand. We have a microphone, please. If you wouldn't mind introducing yourself if you're comfortable.
Sure. Hey, I'm Mark. I'm a primary care physician, and great talk, guys. So I wrote this question down just to be prepared. AI looks to be a great tool, and I've been to numerous events where they said that AI will be intertwined in the near future with the practice of medicine and healthcare and all that. I agree, it looks to be a great tool, same with social media. However, these can be used as streams of misinformation. How can we get back to just plain literacy? Just as Corey mentioned, how can we get people to ask the right questions, comprehend the answers? Because there are clear issues with literacy. The US economy, it costs almost $349 billion in health literacy costs. So that's equivalent to like the total value of the MLB, NFL, and NBA combined. How do we get people to care about healthcare other than when they're just worried about their fantasy football team, their quarterback having issues with their ACL and stuff like that? Also, AI will be intertwined with our futures, just like the smartphone and social media, and it will be important moving forward. But how can we address the brain rot and doom scrolling, not just in the US, but globally? And you guys, I guess, touched up on it, the narratives and storytelling, but can you elaborate on that?
I'm going to start. I know we can't answer every question you raised there, but appreciate your questions. I think one thing I wanted to recognize was that there's a little tension in what we're advising you today. On the one hand, we want everyone to make their own decision. And on the other hand, we also want to acknowledge the uncertainty in science, but we only want them to pay attention to basically the best science information. And you can see how hard of a challenge this is. In health literacy, which is, it should be part of science literacy, but often people mean kind of more fundamental concepts. One thing that strikes me about health literacy in particular is that you're talking about people who that the need is pretty high. And so the people I've seen do it best really are the most approachable, the least white coat of the doctors. And so that they really make it easy for people to admit what they don't know and to help understand what they need to know in language that they can relate to. I think we need all of those different kinds of communication out there. There are people who are really good at that, and we need to lift them up. As you say, as a society, we should lift them up and help them do more. And then we also need, the people reading the medical journals on their own. So we need that full range.
There were so many questions there. Yeah,
We'll just start with some.
Yeah, no. You asked a lot of good, tough questions. Look, I mean, I think people have been talking about sort of reforming the education system in the United States. Certainly, as long as I've been, in journalism, I mean, this has been sort of a nonstop buzz. Like, we've got to teach more general principles. I'm sure it goes back far, far before that. So, obviously there are some fundamental challenges to changing the way the education system works, especially with the needs of standardized testing and all these different things that keep the system working the way it does. But just before this event, I was talking to other panelists. My firsthand experience. So I have a daughter in high school. She's at one of the specialty high schools in New York City that specializes in math, science, and engineering. It should be one of the great incubators for for curious, open-ended science thinking. And she's just getting slammed with all these memorization tasks and sort of fill in the dot exercises, and was just like she was saying literally, I love science and this school is making me hate science. This is making me so upset. So there's clearly there's a big problem there, and there's also a problem that's been very, very tough to reform. But I think getting even just a little more around the edges, a little more about the scientific method and the sort of right and wrong ways of asking questions. I think if you can get even just a little bit more of that into our educational system, that's one thing that would be very helpful. And the other thing, I mean, to your point earlier about the CDC and the masking rules, I know the CDC was in a really, really difficult hot seat position, and on the whole, I think they did a very good job. But there were a lot of people from the science communication side who really felt like when those masking rules changed, there was this kind of narrative like, okay, we knew what was right before, and we know what's right now, and there was not such a good messaging of like, how did you get from here to there? And I mean, that would have been a really difficult thing to pull off regardless, and there are a lot of people who would not have listened. But I think there's a segment of the population that would have listened and that was open to hearing, what, we were doing our best. We got more information. Our guidance before was the best we knew at the time. We know more now. It turns out we were wrong. Here's something better. It's a difficult message for a public official to pull off, but I really wish that they had done a little bit more of that.
Well, you're gonna just make me tag on to that, which is the other thing for the advice segment of this program is to also say the best evidence for what. This was one of our learning curves, was what is public health? Why, what is its goal essentially? And that's different than what is personal health care. And so they needed to be a little more clear about the goal, which was to save as many lives as possible at times, or to take the pressure off the hospital and medical centers. That's different than what do you do about what's best for my personal health in a clinical room.
Yeah.
Another question from the audience. Please introduce yourself.
Hi, Lily Rosenthal. I'm a physician. Thank you very much for a very stimulating and important conversation. 35 years of practicing medicine. I take my job very seriously in health promotion for patients, keeping people healthy. Fancy that, right? It's not all pills and procedures, with all due respect to this beautiful site and what's going on in this building. I think I gain the trust of my patients by being honest that science is evolving. Thank you very much. I think that we need to have many more articles and conversations about this with the public health, which has not even been part of this conversation, is probably the large majority of how people can keep themselves healthy. Food, exercise, sleep, not sexy, makes nobody money. Incentives financially are totally misaligned, except when you save trillions of dollars. If we could put some resources on the front end, and the conversations, which I appreciate, which you've mentioned a few times, is I'm always telling my patients that medicine is a human science of probabilities, which is based on body of research over eons of time, and I am here to help digest this and with you make the best decisions for your personal health. And that, I think, helps my patients work with me because it's ultimately a conversation. It's not a one-way, this is what you should do. And I have those conversations regularly, daily with patients. And yes, doctors are time-starved. Yes, doctors are leaving. We need help from a public health system on the messaging of, even my daughter's in a graduate in public health program in Boston. We need so much more messaging because people are tired of the passivity of the healthcare system. If here's a one-size-fits-all pill, here's a procedure, there are side effects. I don't know how to do it differently because the incentives are totally the bridge seems too far. So I'm hoping for some ideas on that.
I'll just comment briefly because I think the way you talked about it, that I'm here to give you the best advice I can, but this idea that we're making the decision together, you're not, it's very slightly more modern way to approach it, but it is, that's the tool, right? That's the way to go about it. The other ways I've heard people talk about it that's on the, effective side is to just explain a little more about why you think this is the best direction, right? But it's a different kind of healthcare system than 30 years ago where you just gave the prescription, so to speak. You said, do this, right? It is a much more, you have to bring people along, and it can be frustrating. I hear a lot of frustration when I talk to physicians because you're part of a system, a society, essentially, that is thinking about more, that it's okay to question authority figures, and physicians are just one of them. And I think one of the perhaps scariest thoughts that I heard at focus groups is essentially the idea that, well, that's just their opinion. I'll just go to another doctor and get another opinion. That's the system we're living in. And I know it's really frustrating. You did all those years of study and you know a heck of a lot more than I do. But this is your clientele now. They're a more questioning public, and they need to be brought along a little bit differently.
Well, I actually have a quick question for Carrie following up on that, because my impression from the polling, I think some of this was polling from Pew, is that on the whole, the level of trust in scientists and medical professionals is quite high. And when you look at other authority figures, you look at military or religious, there's a downward slope in almost every area of authority. Compared to that, scientists and doctors are actually doing relatively well. Is that true?
Yes. I love that you're taking your own advice. Compared to what? So yes, in these kind of broad measures of confidence in scientists, they do pretty well compared to other groups and institutions, but that's because some of those other groups and institutions really have very, very, very low levels of trust. Those including media, elected officials, essentially business leaders, right? And so what I like to say, there are a lot of people who say don't panic about the level of trust in scientists, but just because you shouldn't panic doesn't mean you should do nothing. So I like to look at the size of the group that has really strong confidence and say, well, it could be higher. And you look at the size of the group that has a little more negative or skeptical view, and that has grown. And so that just tells you that as a community, as a society, we need to be attending to why and what could we be doing differently to help kind of breed a more of a trusting perspective. And we know from another article that's coming out, well, what could you do? You need to think of it as more of a relationship. So to your point about bringing people in, it's a group decision. Trust is built on relationships. And so that's what you need to be thinking about at the kind of big scale of trust in scientists writ large.
We're out of time, but maybe one more quick question if you don't mind.
Hi, my name is Andrea Bartson. I've spent a lifetime in healthcare, 30 years in the pharmaceutical industry, so I see the big picture, both on alternative health prevention side and traditional science. So what I see from that lens is that we have a system that's been created on old paradigms, right? So this system was a reactionary system in some ways it was proactive, as we created the American Medical Association and the pharmaceutical industry based on good reason back then. But the saying goes, you can't create a new system or come up with solutions of a new problems based on old data or old paradigms. So I think what's happening now, and would love to get your opinion on it, because now that we have AI and data and we're looking at new things in new ways, including AI looking at genomic factors of what causes diseases, and consumers have in their hand all kinds of data points to actually make their own decisions, it's actually naturally upending the system. But we're not proactively designing for that future view. So
Let
I
me
think
let me add in there, because I think that's really interesting.
yeah.
What's happening with AI that's interesting from my perspective is, in fact, it is forcing us to design new systems in many ways. And that's giving us a new opportunity to kind of build in more accountability, because we need to be more mindful of, are these new systems, being applied in an equitable way, inclusive way? Are there systematic biases of any kind? And I do think that those efforts are going on now. They're probably not, they're not in place everywhere, but that conversation is going on across every sector that I know of. And so it's a great opportunity for us as a society to say, how do we want to build these new systems with AI in it?
Yeah, and look, and I think one of the dangers of not doing this right is that, I mean, you can see this happening in our society right now. I mean, there are people who are questioning everything, and there's also, there's a significant part of the public that really does just want simple answers. They want there to be, like there's one person out there whose values I think reflect mine, and whatever that person says, I'll go along with it. I mean, there's a natural human tendency to want, it's exhausting to have to question everything all the time. And I think that the danger in not setting the right systems and not communicating honestly and not, it's kind of like getting public buy-in, is that it makes the situation very ripe for for people to just kind of give up and say, you know what, the hell with it. I'll go with somebody who just says he's got all the answers. And that's, I mean, I feel like that's, if you're thinking about what it is that we're looking toward, and I mean, not just this election. I'm thinking, over the coming decades. I mean, you can see, and not just in the United States. These are, when there's no one, when there's no one institution that you're really trusting in, and when you feel like there's just this sort of endless conflicting information, it does create a really ripe situation for just one person who has the answers. I think that's kind of what we're all trying to avoid.
We are out of time, so thank you to our panelists and to our audience today. Really appreciate that you could join. As we mentioned, this event is in coordination with a magazine that we've published with Nautilus, Science at the Ballot Box, and it's available at Nautilus's website and soon on the Aspen Institute website. Thank you again and have a great evening.